The evaluation has to be very objective.
Okay.
So I want to know the original site of the cancer, whether it's cancer of the breast, cancer of the colon, cancer of the pancreas. I want to know how advanced this cancer is, and if the patient has metastases to the liver, to the lungs, to the bones. I want to know how aggressive this tumor is. There are certain cancers that are more aggressive than others, and within the same cancer, there can be variations, and the pathology report usually can tell me that. So I want to know everything possible, from the type, the aggressiveness, and the stage of the patient's cancer when they arrive. And so we do that very objectively. We have to have the pathology report. We have to have the x-rays that will corroborate the present status of the patient. And so we want to have a baseline when they are here, so that we can then make a comparison in the future as to the response of the therapy. And so those are things that are basic in oncology that you need to know. And then the next step is for us to understand where the patient is emotionally and spiritually with this. Because, again, fear is the main factor. And if we can take the patient from fear to peace, it makes it completely, it makes a difference on how successful you're going to be with the therapy. So we also evaluate the patient's state of mind. Spirituality is a little bit more difficult, but a lot of times it's immediate. You know, the patient said, well, I'm in God's hands and I came to you for help, but I know that I have victory and I have accepted Christ, but if I can live longer, I want to live longer. So in some cases, you will also evaluate the spiritual status of the patient. But I do this overall evaluation of a patient when they first arrive here.